My name's Lisa Miller, and I am originally a registered nurse. I started out as an intensive care nurse and then became a nurse manager of 48-bed oncology unit. Tell me if I need to speak up or do anything, would you? Okay. And went on in my career to do many other things. Focused a lot on quality and service, and was vice president at California Pacific Medical Center for many years for the areas of clinical quality as well as service excellence. I had many things: medical staff peer review, all sorts of areas that I had responsibility for. And as it turned out in my life, I had a circumstance where my best girlfriend of 25 some years developed Lou Gehrig's disease, bulbar. Let me stop for a minute and say, how many in the room are nurses and physicians, social workers, psychologists, and non-medical but caregivers of people at home? Thank you for being here. So that's what made me ask that question, because as my friend had Lou Gehrig's disease, and toward the end of her life she had bulbar ALS, and so that has a pretty short lifespan prognosis. I decided to step down from my role and assist her family and do hospice care and be there for her family. So I did have the experience on the reverse side as a caregiver for that period of time. And after that, and actually during the time and after, I then started my own work. And I work with, I went back and got my doctorate in organizational leadership studies, and I work with teams of nurses as well as physicians. I do team work, retreat work around compassion fatigue, lots of things like that. And I also do coaching for physicians and nurses, individual coaching. So I wanted to introduce that, and I also wanted to, should we have everyone introduce themselves right now?
Let's do that in each segment.
Okay, all right. But I wanted to just turn to my esteemed colleagues on the panel today and say that what I want to do in my brief section is to talk a little bit, and I have a handout for you. I don't know if you have it, you don't need it yet, but you know, there's lots of information, and I'm not going to, yes, thank you. I'm not going to go through all of this information. I did this so that you would have additional information to go home with. I want to talk a little bit about compassion fatigue, how it is similar to burnout, but not exactly the same. I want to also introduce a new field of social neuroscience and a focus around positivity as it relates to skills that as caregivers we can develop and fine-tune in order to develop our capacity for resiliency. Resiliency is a characteristic and a skill that can be learned. And so I want to make those connections between that. And I won't go into too much of the interventions. I have some suggestions. My colleague Joan Forte Scott, who's in the audience today, made the suggestion that I give a couple little tips. Well, I have a lot of little tips in here, but the biggest tip is that I'm going to turn it on to my colleagues who will get into that more. So really my role this evening is to kind of establish a context and then set it up for the rest of the colleagues on the panel. Does that sound good with you? Okay. So the first thing is that, you know, for the most, 99.9% of us all went into healthcare. I do a lot of this appreciative inquiry work where I ask people, how did you choose the profession? Why did you choose it? And almost everyone has the intention of going in to help, to make a difference, you know, to provide compassionate care, empathetic care. But because of that, and because of the nature of our work, someone described it as emotional labor. It really is it isn't just a physical labor, it's an emotional labor. Because of that emotional labor and that type of our work, we can be subject to catching the distress and the anxiety, the fear and the sense of hopelessness that sometimes that our patients and family members have. We can be vulnerable to that. Unless we're proactive, unless we're cognizant, unless we support each other, and unless we obviously take care of ourselves. So ironically, we choose a relationship profession. We choose a profession in which we have this very intense relationship with our patients, with our families, and with our colleagues. But in fact, the relationship that is sometimes left to suffer a little bit is the relationship with self. So that's an important concept that I wanted to mention. Compassion fatigue was coined in the early 90s, actually, by a nurse who described it as a unique form of burnout. So it's kind of a specific form of burnout that's specific to individuals that are caring for others. And she described it as a loss of ability to nurture. More recently, compassion fatigue has taken on a broader definition that includes physical, emotional, and spiritual depletion, which is associated, of course, with caring for patients in significant emotional pain and distress. It has been reported in emergency department personnel. It's been reported with cancer care providers. It's been reported with physicians, with chaplains, with first responders, social workers, counselors, and others. Nurses are particularly vulnerable to compassion fatigue, or so the literature describes, because of the intimacy and the long-term arrangement. And actually, I mentioned I do a lot of coaching with physicians, and I was coaching a physician who has, pretty extraordinary patients and some pretty sad situations. And I said, I just asked him, how do you do it? And he goes, well, I'm really sensitive. I let my nurse handle that part of it. And, so I think I see some nurses in the audience kind of shaking their heads and nodding that it doesn't mean that it doesn't happen with physicians, but again, because the intimacy in the long term and because you're with the patients during the most intimate of things that happen with them, that nurses are in general more vulnerable. It's not exactly the same as burnout. Burnout happens can happen over a longer period of time and tends to be related more to structural things or politics or the way things are organized or a supervisor or those kind of things. So, but compassion fatigue can come on very acutely, and the onset of it may or may not be precipitated by an over-involvement. Actually, it's going the other direction, being too involved in the patient family care. It has been described as a type of vicarious or a secondary post-traumatic stress. In fact, secondary traumatic stress disorder. So that's a pretty significant thing to think about, and we have an expert here from the VA who could probably speak to that in that regard. And as I mentioned before, it includes symptoms that are related to the actual work environment, to the physical component of the patient, of the caregiver, as well as emotional symptoms. Some of the work, I won't go into all of this is in the presentation, but some of it is, just an overwhelming dread, feeling sick at your stomach, you don't want to go to work, you can be, again, over-involvement, or it can be under-involvement, and a sense of somewhat lack of joy. Physical symptoms, the same kind of things that you would anticipate with overwhelm and stress would be muscle tension, headaches, gastrointestinal, fatigue, even cardiac symptoms. Emotional symptoms, restlessness, irritability, mood swings, anxiety, ambivalence, again, a loss of objectivity, memory issues, and poor judgment, poor concentration, poor judgment. As one of the things that I will talk about, and I'm sure that my colleagues will talk about as well, is that, again, a main central theme is care of self. And part of care of self is being able to reach out to others and to gain support from each other. And then, as colleagues, as those of us in healthcare, being able to learn the signs and symptoms so that we can recognize it in others and to support each other. Very, very important concept. Intervention can be things like tonight, panels and seeking out a mentor or a buddy, as I mentioned before, pastoral spiritual care, healthy rituals built into your daily life. Many organizations now are proactive about this, having relaxation centers, quiet rooms, something called Code Lavender that I think one of my colleagues is going to talk about a little bit more, gardens, the Schwartz Center rounds, which those of you at Stanford, I hope you've availed yourself of, but that's a national thing that was developed by a patient who passed away. And again, very importantly, a notion of positive self-care. And that, I'm going to make the very quick segue into positivity, which is a field of study in the theoretical underpinnings of my dissertation work, which is on peer-to-peer coaching. And I just want to simply say, because this is way too big, this is an 8-hour thing, but I just want to say that there is a profound amount of science out there that is converging, both from the psychological world, from the world of organization and development, from all sorts of areas, from neuroscience, that's converging, that's looking at not so much the problem focus or the deficit focus, but what happens, what are the characteristics, the enduring traits, and the things, the behaviors that we do when we have people, let's say 9/11, people who survived or were resilient after 9/11 versus people who maybe languished a little bit more. So a focus on what are the characteristics and the enduring qualities and the habits that people do that face life's always life's adversity, but can survive them and can come out the other side. So those are some of the skill sets that we're learning about. And I just want to say one more thing about positivity and also negativity, and then I'll turn it over to my colleague. But first, I want to say that the whole notion of positivity, this new social science, it's not about the happy yellow face. It isn't about the button, smiley positivity. It is a means, not an end. It's the difference, again, between languishing or sort of a downward spiral versus an upward spiral of flourishing. And the skills in developing positivity build resiliency, capacity, and capabilities. A word about negativity. There is adversity that happens to us that is negative, and we can't help it. It's just things that happen in our life. But there is an awful lot of negativity in the world that is gratuitous, that's out there, and we either avail ourselves to it or not, like the media. As we all know, what bleeds leads, right? So there would be strategies and tactics to reduce the amount of negativity that we have a choice to. Like participating in gossip, participating in sarcastic remarks. Those are all things that bring us down that we have a choice about. So I wanted to say that there's negativity that we can't help that's out there that we have to deal with, and then there's some that we can actually eliminate. And the goal is to, if you think of it in a ratio, which one of the foremost respective researchers in this area talks about the ratio of positivity to negativity. So if we can increase our positivity and reduce our negativity, we're developing, again, these resilient skills and capacity. So many good things about positive emotions and all this, physiologically, mentally, everything. There's a theory called the broaden and build theory, which basically says physiologically, when we're seated with positive emotion, which tonight is positive emotion, when we collectively come together, we're being inspired, we're communally together. It broadens our minds, it opens our heart, and broadens us, and creates a better resiliency. So am going to pretty much leave it at that. And again, there's more in here. You can take a look at that. If you have any questions, we can do it at the end. And also, I have my email and phone there. So I'm going to turn it over to Jim.
Thanks, Lisa. Good evening. I'm Jim Mulvaney from CARA. And at CARA, I have the role of Director of Training and Education. And as part of that, we go out into the community and we train the community in terms of basic education around grief and end of life. But also in the professional community, we do trainings related to some of the things that you've talked about, Lisa, compassion fatigue, how to create and cultivate compassion, how to do self-care, and so forth. The other area that I cover is CARA services for end of life. And CARA does not just support those who are in bereavement after a death, but we have three types of end-of-life clients. One is the person who themselves is dying. The other is a loved one who's anticipating the death of a loved one. And the third would be caregivers of the loved one, and that includes both the professional as well as the informal or family and friend caregivers. A little bit about my background. I didn't start out in this kind of profession. I was first an engineer and then computer science, and then ran my own company doing web development. And then in late 2000, my wife died suddenly. Unexpected, no warning. And I came to CARA as a client, and I had a peer counselor for about a year. That was very helpful. And after I closed, about 6 months later, CARA invited me to consider becoming a volunteer myself. And at that point, it just felt like the right thing to do. So I went through their training, became a volunteer peer counselor, and later was invited to join staff, heading up the adult services program initially, a couple of other positions, and then landed here in the position I'm currently in. So this has not been a profession I've been in for my entire adult life. But I find that just having experiences myself as well as sitting with my clients over the years has given me such a wonderful perspective, a deep perspective. And particularly about caregiving, I remember my first client who was also a caregiver. And he was caring for his mother, actually, for about 4.5 years. And he came to us after his mother had died. But what he talked so much about was the experience that he had caregiving for his mother, how he gave up his job, and that was 100% of his focus for that amount of time. And then when she died, he was completely left directionless. So that was and he said, you know, CARA should really do something for caregivers. So that was my first clue that this was a great need in the community. And it's a real privilege to be here, to be part of this program and talk with you all. So what I'm going to focus on is picking up on some of Lisa's themes around self-care. First, I want to talk a bit about kindness to self. And there's a handout that you should have. Let's see, it looks like this, without the... Oh, okay. So did we not hand out the others? Okay.
That's mine.
Yeah, I was looking at your name and I said that is Karen's and that's the other one.
Well, while they're being handed out, I'll start to talk about this. But the first thing about kindness, we typically think of this as something for somebody else. This is something we offer to another person, kindness. We don't often think of it as something as how we treat ourselves. Being in the caregiving profession, it's very important actually to turn this inward. So unkindness towards self, there's a whole bunch, there's about 14 items that I listed here, but I'm just going to touch on a couple of these as examples. How does unkindness to ourselves happen? Well, one is how we compare and judge ourselves against others. Now, this has nothing to do with the actual situation we're dealing with, does it? We could be taking care of a patient who's at end of life, who may be in hospice, who just has a few more weeks to live. And there's certainly challenges and urgencies around that situation. But on top of that, if I heap this and compare myself and say, you know, I'm not doing as well as I should or someone else is doing, I'm actually heaping on top of the challenge all of this additional mental suffering that really has no purpose and goes nowhere. It just adds to my burden and depletes me faster than it would otherwise. So it's very important in my experience to be mindful of my own thinking and how it's affecting me. So this is one example. Another is how I take things personally. Things happen out there, and I just notice that I often will take it personally, that it's something about me personally, and find out later that absolutely it had nothing to do with that. In the meantime, I've been suffering for hours or days or weeks, however long that was, while I'm holding the thought that this was something to do with me. And I can't tell you how many times when I've learned to actually check things out with people more later in life than I did as a younger man. And I have found that my score of accuracy is abysmal. It's really awful. I would say that close to 90% of the time I'm either mildly inaccurate or completely off the map in terms of what was really happening. So I've learned to become very watchful with my thinking and careful about what beliefs I take on, and also questioning beliefs I've had perhaps for most of my life. Another one I'll call out here is, especially in the caregiving professions, sometimes we want to do everything for everyone. It's important for me to acknowledge what my capabilities are and what they're not, and what I can do now and what I can't. And again, with this theme of kindness, that will guide the choices and the commitments I make moment to moment to moment throughout any given day. I don't wait for the end of the day to start taking care of myself. It's important for me to be doing that throughout. And it's in those small ways that add up cumulatively and actually reduce my general sense of depletion and stress. One thing I'll also call out is there are times where we have to push through. There's some kind of urgent situation and we need to take care of it, and we pull out all the stops and maybe work 24 hours or whatever it takes to get through that particular crisis. We're built to be able to do that. What we're not built to be able to do is a long-term kind of overburdening ourselves. So it's important not to disregard the signals of imbalance over the long term. We can accommodate short-term situations, but if it's especially with family and friend caregivers that I've dealt with over the years, this happens for years. And no one out there appreciates the role that they are playing, the stresses that are involved, so there's very little help physically or especially emotionally from those that they know. Another one I'll call out here is neglect to notice and to question the truth of my beliefs and expectations that cause me suffering. And one of the practices that I have found back in '94 is the work of Byron Katie. And that provides a simple inquiry tool, a series of questions for me to actually examine my belief and my thinking, see what's true about it and what isn't. And it's just amazing how much of a relief that I get from that. Rather than just to have my beliefs run me, I can actually stand outside them and really take a look at them. I'm going to give us a small example of that before I close. Moving on to practicing kindness towards self, and certainly doing the inquiry practice I just mentioned is one of the ways that I do that. So practice noticing when I'm wanting things to be different than they are. Now, we've probably heard about this in many different ways and many different situations. It seems obvious, but we don't really realize what the impact of it is. So for instance, when I'm wanting things to be different, it's actually reducing my capacity, my skillfulness, my awareness, all of my abilities. It's reducing them in the situation when I need it most. Okay, so if I'm dealing with a particular client, if I am not able to accept what the situation is, where the client is coming from, and I'm at war with that, I'm handicapping my own ability to serve that client. And I've just seen that so many times that it's one of my mantras. Another one having that I really find helpful to be reminded of: do just what has to be done right now, for that's all I can do. And this has been really a very big theme in my work with clients who are family and friend caregivers. Well, also for those who are themselves dying. Because our tendency is to go way down the road and imagine things happening down there, which takes our attention off the immediate situation, what our experience is, and what our options are for the next step. It's, once I have done everything I can do about a particular situation now, I've got to find something else to direct my mind to do because it will just keep spinning its wheels and I will suffer and suffer and suffer. Now, has anyone noticed some of these things I'm talking about? Has anyone experienced? Just raise your hand if you've experienced any of this. Yeah, because this is basic human nature, isn't it? It's basic human nature. Those of us who are caregivers, however, the heat is turned up. So what might be mild discomfort for most folks can become really quite painful in a situation as intense as some of the caregiving situations that we're in. On the back of that sheet, there are just a couple of thoughts there, and I'll talk about one or two of them. The first bullet says, fully accepting what is true in the moment is the only firm ground upon which to make changes in your life and to heal. So that point of acceptance is really important, because that's what I'm dealing with, and if I want to be effective in helping myself, I've got to start from that kind of acceptance. The other thing, when I talk about kindness to self, it almost always comes up, well, isn't that selfish? Isn't that selfish to do the kinds of things that I'm talking about here? Well, what if someone is suffering in pain and here you are trying to, take care of yourself? I like this quote from Daniel Goleman from Emotional Intelligence. He says, the internal work and the external work of caregiving are the same. The more you can develop the internal ability to be a calm, compassionate presence toward yourself, the more you can bring that presence to everyone that you serve. If I'm beating myself up with my thinking, if I'm depleting myself, the care and support that I can provide others is greatly reduced. And one that relates to this, the more that I'm able to be with myself in a kind way, the more kindness and help I can offer to you. So I'm just going to close with a couple of things about Cara. This series that has been put on, and this is the second panel I've participated in, it was very interesting for me to see how much interest in the community there is for this kind of support. So Cara is about to launch what we're calling the Caregivers Forum. And that will be launched, in fact, here at this location 3 weeks from tonight. And the second handout that I have for you, this pink-colored sheet, talks about the Caregiver Forum at the bottom. And you can either call Cara or go to the website and put in a reservation for a seat here if you would like to attend that. And please spread the word around, because we would like to make this as widespread as possible. This will be the first. We're not sure how often it will be presented. It may not start out monthly, but at least quarterly. And depending on the feedback we're getting from participants, it may be more frequently offered. So I think that's enough for me for now, and I'm going to turn that over to my colleague. Thank you.
Well, so far I think we're in the right order. And lucky for me, my introduction about myself is my panel presentation. I have been a licensed clinical social worker for 40 years. And when Pam called, or emailed and called about I'm sorry? Oh, Karen Schwick, sorry. And this was months ago, and I said, yeah, sure, sign me up. I'll be happy to do a caregiver panel. And know lots about, I work at the VA in Palo Alto, and So then it got closer, all these emails started coming and go, well, I better see when is this and what's the topic? And then I looked and I said, oh, what's the topic? At the end of the day, how can I care for myself? Identifying resources and coping skills for healthcare professionals. Oh, okay. So we're not talking about, it's not the caregiver, what I initially thought was the caregiver providing the care to like my veterans, my cancer patients. It was really talking about, I have to talk about myself. And I thought, well, I have been doing this for 40 years. I must have something to say. There must be some lesson learned that I can share with colleagues about how I've done this for so long, and I'm still doing it. So I have a master's in social work. I've been a social worker for 40 years. Work at the VA in Palo Alto. I'm the senior social worker in oncology and hematology. So if you go to the VA and you have cancer, I'm your social worker. I didn't start out that way. I started out my career in social work working with the chronically mentally ill, that population. And through that, out of graduate school, and I'm a psychotherapist, and I'm working in mental health and mental illness, and I was very clinical and very Freudian. That was my framework. That was what I knew, and that's who I was, and that's my relationship with some of you probably started out that way too. And with that framework, you said very little. I was a really good listener. I was really good at reflecting, asking some questions, never talking about myself, never answering questions, and just being, a strict Freudian therapist. And then after a while, it kind of became clear, well, sometimes people really do need answers. They really do want my opinion. And I began to change that framework and became somewhat more eclectic and not just strictly, asking questions or being reflective and just asking how you feel about this or why did you ask me that. It was a lot of questions about myself. Are you married? Of course, which I never answered. Now they don't ask me that. Now I just get asked, are you going to retire? So it's kind of just shifted from that. And I just say, no, I answer that question, I'm not. So in thinking about doing this presentation, one example that came to mind, I worked for many years with the National Alliance for the Mentally Ill, NAMI, and did a weekly caregiver support group for caregivers of the mentally ill. And I had a family that came in, and they had I lived in Miami, and they just relocated from New Hampshire, and with their son, who was a schizophrenic. The husband got a new job, and they thought, well, this might be good. It's Florida, it's sunshine, it's palm trees. It's going to be wonderful. Well, they weren't there less than a week, and their 19-year-old son got arrested, got into an altercation with Miami-Dade County Police and ended up in Ward D, which is the ward for the criminally insane. And he was this kid, he just wasn't on his meds, that whole kind of picture. And the mother came to the support group. She had been coming, and we kind of had to resolve and get the attorney and get him out of jail and get him situated. And she turned to me in the meeting and said, what do you think I should do? And to me, it was like a pivotal moment. I really have to answer this question. I cannot sit back and be reflective and ask, why are you asking? She really needed to know what to do. And I gave her my opinion. I think you should move back to New Hampshire. And they kind of all gasped. And why did you say that? So, well, you live in Miami. Florida has no state income tax. There are no services for anybody. For the mentally ill, for children, for homeless, for seniors, there's nothing for anybody. Everyone's treated equally. Nobody has anything. And it's still that way. So when I came to California and there's all these agencies and services, it was like, this is wonderful. So, and they moved back to New Hampshire. And she sent me, I get in the mail, a container of maple syrup, and with a note that said, this was the best advice anybody ever gave me. And I thought, yes, that was important at that point for me to give my opinion or to give that advice or really to answer the question. And so then when I'm looking back at kind of like my career and how I've evolved. And I think that's, as a professional, you have to do that. It's really being able to know yourself and have that confidence to answer that question. Probably when I first started out, as in my field, I couldn't do that. I didn't have that expertise or the knowledge or the experience. But certainly at that point in my career, I could answer that confidently and give that person that advice. So I certainly became more eclectic in doing what I was doing as a social worker. So things kind of went along, and my 19-year-old son decided to join the United States Navy in the middle of 2 wars. So speaking of stress, that was pretty stressful. So I decided I needed to do something, and the thing that I did was made the decision, I'm just going to take on life's top 10 stressors in 1 year, do them all, plus my son who joined the military. And I decided I needed to make a whole career change and work with veterans. So I applied online, and he deployed to the Persian Gulf, and I deployed myself to California and with the job at the VA and working with as the senior social worker in oncology and hematology. So now I went from working with the chronically mentally ill to...
This just happens every night about this
Oh.
time. It'll go away and everything's fine.
Should I continue?
Yes, go right ahead.
Oh, okay. So now I'm, he deployed, I did all my life stressors, got them all done in 1 year, and here I am in California working at the VA. And so this is the one quote. It is in the handout, Ralph Waldo Emerson, who said, "It is one of the most beautiful compensations of this life that no man can sincerely try to help another without helping himself first." And I, truly believe, and I think that's what we're talking about here, is really being able to understand yourself and help yourself and to identify what your own strengths are, and we all have those weaknesses, and be able to identify them and use them to work for you in the way that you're dealing with your patients, or in my case, my veterans. So the next couple of things that I have here are the cartoons. And why did I include that was because I realized moving to California and dealing with this huge bureaucracy in the Department of Veterans Affairs, I better have a really good sense of humor as my way of coping with the stresses of not so much doing my job, but dealing with the bureaucracy and the technology. And I really can say that you can teach old dogs new tricks, because I've had to develop, learn all the computer systems and the codes and the passwords and the emails and the computerized patient record system. And so you can do that, but it's really recognizing it's really going to be very challenging to me, and I better get my sense of humor and be able to use that in dealing with, the challenges that are going to come up in working in the VA system, and which I would imagine would apply working in any big bureaucratic system, because we all have our things, the paperwork and the demographics and the notes and all the demands of the infrastructure of the VA. So I've included some of those, which I think that they're kind of funny, especially the one quote that says, "There's so much stress at work that Friday is take my therapist to work day," and yes, and it's really recognizing that there's a stress that comes from what you do, and you're talking about talking about grief and those kinds of issues, but you're also talking about that. You are stressed, and to recognize those signs within yourself, because if you don't do that, it can quickly turn into really all the symptoms of burnout, which is kind of going into the next slide there. So you really want to be able to recognize those things when you're feeling. You're driving to work and you already hate your job, and you hate the traffic, and you hate the music, and you just go through this litany of things, and it doesn't get better when you get to work, because you've got all the demands and all the pressures. But you have to begin to recognize that within yourself. what is going on and to make those changes so you can handle the stress before it becomes elevated and escalated to where you're really burnt out and you really, really don't like what you're doing, which really means that you don't like yourself and haven't developed the strategies to deal with it. So yes, I've had to develop strategies to deal with certainly dealing, in the VA and all the challenges in dealing with cancer patients and dealing with sickness. Now it's not a mental sickness, we have a medical problem. And it's the time that you spent trying to recognize the things that bother you the most and what can you, and I think you two were talking about it, how are you going to develop those strategies to deal with it? And when we talk about, and I think you've referenced, we can look at the literature and we can look at the science and we look at all of that, but how do you actually do any of this? Yes, we can look at the theories, but how do you do it? And I think the first step, not just that you're here, but really taking the time and doing your own personal inventory and thinking about like the kind of person you are and what your strengths are and what your weaknesses are and what are those things, and when you're talking about what are the things that are really going to, tip you over, that are really the most difficult and challenging, and just face them and make a plan for yourself, because things just don't happen. You kind of have to make them happen. So over the years, those are the kinds of things that I've had to do to develop skills within myself to look at the kinds of veterans that I see, or the kinds of problems that I know that, oh, this is something that I might have to ask a colleague. I've dealt with this person so many times that I don't seem to be going anywhere. Why don't you take over for a while? Doesn't mean that I failed. It just means that change in this particular case is good and it's okay. And you have to be able to move on. So you also mentioned, when you're talking about recognizing what the stressors are and then reversing them. And I think I've listed a whole bunch of things that you can do to, talking to people, whether it's chaplains or friends or your yoga teacher or whoever, to reverse that. And then you develop the resilience so all of that doesn't happen again. And we so often talk to the veterans about, are you eating and sleeping and all those kind of basic things. But those are the things you have to ask yourself. Did you go to lunch today? Did you, have a coffee break? Did you take the time to do just the simple little things? And maybe, and then I was thinking, well, with all this technology here in Silicon Valley, well, some people find technology, it's kind of relaxing. They like to, check their Facebook and, text message and do those kinds of things. So I can't say that I can't say that people shouldn't do that. I have to text message because I have kids and now I have grandchildren. So it's really important to be able to text and go on Facebook and things like that. So a couple of work examples that I've done, just want to share this. So I instituted a program really pretty much when I came to the VA, and fortunately for me, with all the experience, they said, Karen, whatever you want to do, develop in oncology and hematology, just go ahead. Okay, that was great. And so I started a monthly support group for our chemotherapy nurses. It's a great group. They work in a very small area. And it's very intense. They're doing chemotherapy. And so I have a group I call Breakfast with Karen, and we meet once a month on a Thursday at 7:30 in the morning. I bring coffee and bagels, and we just sit and talk. Did you see a movie or something like that? Or we may talk about patients or the veterans that we've gotten very close with and who died. Who died this past month? Oh, I didn't know that somebody had passed away, and what the impact it has, and be able to talk about how they felt about it, or somebody who's getting a lot of chemo and they're really doing terribly, and you kind of see the trajectory and things aren't going well for them. And it's really to be able to give them that support. Another thing that I've instituted most recently, before every clinic day, before we start the day, with all the oncology providers, the oncologists, the fellows, the interns, the PA, there's the RNs, behavioral medicine, nurse practitioners, the LVNs, just anybody. It's just a small huddle, which I call Karen's huddle. And it's 5 minutes, and I just tell them, okay, I want your attention. They're kind of used to it now, but they give me a lot of resistance. It's 5 minutes, and I just talk, that we're part of a team. Just a reminder, don't forget to do your checkout sheet. I baked brownies today. They're in the tin. And if you're going to pay attention to me, it's also pen day. If you want a pen, you can have one. And they go, is it a gel pen? Yes, it's a gel pen. You can have a new pen for your day. And just kind of something like that, which is kind of breaks up the seriousness of what we do and the pace of what we have to do it. And it's very quick. So it's just giving that support and that you're part of a team. And for myself, it makes me feel good that I can do that for this group of nurses and for this group of oncology providers. So to, I want to make sure I didn't forget anything. Just a couple things so I can go full circle, that I did bring a lot of caregiver information for caregivers that's out there about the VA program, which is a wonderful caregiver program. Each VA medical center is mandated by VA central office to have a caregiver coordinator. We have an 800 number, a website, and all kinds of things like that. There is information over there, so I kind of got that in. And also, I left my business card for the reason that all of you probably know somebody that's a veteran and have heard them say, I don't qualify for VA benefits because I didn't go to combat, I didn't serve in Vietnam, I'm World War II, it's too late. None of that is true. There are some restrictions into eligibility, but not very many. And with the new changes in healthcare, lots of people are losing their health insurance, and they will be eligible for VA healthcare. It's not insurance, it's healthcare. And so feel free to pass my card out or ask them to call me. It's a big institution and bureaucracy, but I am a face behind all that and do answer phone calls and emails. So please, if you do know veterans that aren't registered at the VA, they can be. Work very well with the community providers. You can continue seeing all your community providers and have VA health care. And the VA provides lots of services. And two other statements, and I'm done. And one is, I think is important, is who I am is not what I do. Who I am is the person that I am. And that person is what you have to understand and identify your own particular, again, your strengths and weaknesses. And by knowing that will certainly help you do the job that you do. My final comment is my colleague said, are you going to show pictures of your grandchildren? And I said, which I do a lot, but I already mentioned them. And I said, well, I hadn't thought about that, but I'm going to have to get them in here somehow, which I just did. So I think that, that's just an important outlet. So I might not text or Facebook, but then I can check my email to see the latest picture. And that's my break in my day.
That's raising the positivity ratio.
There you go. Thank you. Thank you for inviting me to participate, and thank you to my co-panelists. Rabbi.
Good evening. My name is Lori Klein, and I feel really privileged to be with these colleagues tonight. I am the cancer care chaplain at Stanford Hospital, and I'm ordained as a rabbi. I function in an interfaith capacity, which in this day and age means I work with people of every faith and of no faith. And so I function very broadly. I've also done trainings for many different types of healthcare professionals, both at Stanford and in other places in Northern California. I want to start with a quote from Kitchen Table Wisdom by Dr. Rachel Naomi Remen. And of her books, I think that Kitchen Table Wisdom is the one that really speaks to caregivers the most. And she says, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. And so, that's what we're here tonight. We're recognizing that we get wet and that we want to find ways to come through our experiences and thrive, have resilience and also thrive in our lives while we're being caregivers. I'm going to touch on 3 things tonight, and I'll touch on them, and then if there are questions, I can talk more about them during the next part of the session. I want to talk about entering and leaving and making transitions between patients mindfully and also while taking care of our hearts for those of us caregivers who might spend our day going from one patient to the next or one person we're caring for to the next. I also want to talk about allowing ourselves to have expressive moments of vulnerability, and particularly want to talk about Brené Brown's work. And I also want to talk about developing your own philosophy of loss, why we suffer, what makes us resilient. What is your narrative? How do you make meaning out of what you do? So one of my colleagues at Stanford is Bruce Feldstein, and he is the director of the Jewish chaplaincy there. And back when I was a chaplain resident, he taught me about a way of making use of washing my hands before and after visiting patients, and I've made use of that. So, before we enter any patient's room, we wash our hands. And so his suggestion is to use that time to drop all your other concerns, to bring yourself fully present, and to develop your intention for that visit. And then similarly, when we leave, again, we wash our hands. And so that, again, is a time to drop what we've possibly taken on during that visit. And for me, what I personally would add to that is, I noticed when I first started doing this work that sometimes I'd walk out of a patient's room and I'd realize that I was carrying them with me in a way that was not really helpful to me. And what I was carrying with me was this sense of responsibility, that I am responsible for their emotional and spiritual well-being. Now, of course, while I'm in the room with them, I want to do, through my listening and through my interacting with them, I do want to care for them in that way. But once I leave the room, I don't want to keep carrying them with me because the burden just becomes too great. And so when I'm washing my hands, sometimes I also need to make that extra effort to hand over that responsibility. Now, for me, what that looks like sometimes is I'm handing that responsibility to my sense of the divine, the God of my understanding. I think it's also quite possible, if you're secular, to we work in teams. When patients, particularly when patients are in the hospital, they're there 24 hours a day, and none of us is with them all the time. And so, to really consciously think about your trust in the team that you work with, and you are handing that responsibility over to the team. And it will only be yours to pick up again when you go back into that room or when you're talking with one of your teammates. Also, sometimes I've developed a practice of breathing. There's a lot of work you can do in terms of breathing meditation, and I think that Bruce is going to talk about that a little bit. But something that I do, almost like a breathing first aid that sometimes I might do at the hospital, is I'll consciously think of myself as breathing out the stress and breathing in a sense of calm. Maybe going to a quiet place. Because Karen mentioned that we work sometimes at a very quick pace. So we really don't have time all the time to take an extended break. And so some of these are ideas of what you can do in just a few minutes. Also, there are times when I will consciously think about creating an energetic field around me, or an energetic shield. And I do that sometimes in circumstances when there's a lot of difficult emotion around me. And my job, an important part of my job as chaplain is being the non-anxious presence. And sometimes that can be hard to maintain in a moment when there's a lot of chaos going on around you. And I think for all of us as caregivers, we want to do that in a non-anxious way. So one of the things that I do is I will, sometimes I'll just consciously envision this field of energy around me and charging it and feeling that I'm inside it and it's calm inside my shield while it's still porous enough for me to interact with people. So once we do leave, we do, even though I'm talking about these techniques for handing over responsibility and kind of dropping our concerns about a patient, that's not always what happens. I mean, there always are going to be patients and families and situations who touch our hearts and they stay with us. And that we're human. I mean, of course that's going to happen. And it happens also because people remind us of other people, or we just like them, we just really like them, or we have some other strong reaction to them. And so as we take some of the advice that we've heard about talking with colleagues, I think that one of the things that prevents us from talking with colleagues is a sense of shame, a shame that we're not able to be tough enough, that we're not able to take care of ourselves well enough on our own. I think a lot of folks who work in healthcare and who are caregivers, we think of ourselves as people with a lot of capacity. We have a lot of capacity for caring. And so sometimes it's difficult for us to be vulnerable and to say, this is a little too much for me, or I need to talk about this. So Brené Brown is a social worker and a researcher. And if you are a book reader, she's written a really wonderful readable book called Daring Greatly: How the Courage to be Vulnerable Transforms the Way We Live, Love, Parent, and Lead. And it came out in 2012. If you're not a big book reader, or even if you just want to see one of the most entertaining TED Talks, I'll explain what TED Talks are in a minute, just Google Brené Brown and TED Talk. She has a couple of them. So TED Talks are these, I believe it stands for Technology, Entertainment, and Design. And what they do is they invite thought leaders in different fields to give the talk of their lives in 18 minutes. And so she's given a talk on vulnerability. So just in a nutshell, she basically says that either we are vulnerable, either we, do vulnerability, we show ourselves to be vulnerable, or vulnerability is going to do us. And the way it does us is we tend to isolate, we become more judgmental, we walk around more with a sense of shame. So it's kind of like the getting wet. We really don't have a choice. So what does vulnerable mean? Because she also says when you numb the dark, you numb the light. And so when she talks about not wanting to numb the dark, she's not talking about the kind of negativity that Lisa was talking about before, the negativity you should avoid. She's talking about the negative things in our life which are unavoidable, that you do need to deal with. And so what does being vulnerable mean? Vulnerability means showing up and letting ourselves be seen, really letting ourselves be seen for what we're going through. It means that, it means connecting with other people. And, in a sense, I think we all know what being vulnerable means, because it's the thing we don't want to say, right? Whatever it is, that thing that we don't want to say because it's difficult to say, that's the vulnerable place. And so what she's inviting us to do is to do that. And what her research has shown is that being able to show vulnerability helps make you what she calls wholehearted. And wholehearted people are able to be vulnerable. They have a sense of their own worth. They're able to face uncertainty. They're able to take emotional risks, and they have a sense of being of knowing that they're enough. And she says that wholehearted people, regardless of what happens to them externally, they're the ones who are most resilient. And so that's kind of the positive, I mean, what you could say, going back to Lisa's, what Lisa was saying at the beginning is, being vulnerable starts that positive spiral that helps us be more connected. Studies have shown that healthcare providers tend to take better care of themselves and prevent compassion fatigue and provide more compassionate care to their patients if they have some working philosophy about how to make meaning from suffering and illness. Now that's a tall order. I mean, I recognize that, philosophers and theologians wrestle with that their whole lives. So in some ways, like, who are we to have a working philosophy? And yet that's why it's a working philosophy. So what are some of the beliefs that are floating around out there? Some commonly held philosophies that I hear from a lot of people are, one is, everything happens for a reason, and that reason will be revealed to me. I heard some snickering in the audience, and I just want to say that philosophy doesn't work for everybody. It really doesn't. And I've had patients say to me, if one more person tells me everything happens for a reason, I'm going to slug them. So, but this is a working philosophy that works for some people. Some people say, everything happens for a reason, and I don't know the reason yet, and may never know the reason. So I'm just going to dwell in mystery, and I need to feel comfortable dwelling in mystery. Some people believe that the losses that come to us are a sign of God testing us. And so they see themselves as somebody who is going to take that test and do it as well as they can, bear up under that test. Some people believe that things happen, perhaps randomly, but things happen to us, and we make meaning from them. And that's where we get our strength and resiliency, is by making meaning from them. Ultimately, we integrate everything that happens to us into the narrative of our lives. And so the question is about, what's going to inform your narrative? What are the philosophies that are going to inform your narrative? What are the stories we want to tell ourselves? We tend to, as we talk about our day, those are the tiny narratives. And then there come points, like Karen, in a sense now, has gotten to a point where she's able to tell a narrative that weaves through 40 years of her career. So the smaller narratives weave through bigger narratives. I got to a point several months ago where I realized that I've been working as a chaplain for 7 years, and to some degree what that means is I have been receiving other people's philosophies and theologies and remaining relatively silent, being just mostly silent and sometimes reflective. And I realized that a lot had been put into my pot, and I had this sense that my philosophy and theology had changed in some ways, and I really needed the time to step back and to see, to reintegrate for myself. So what's my new working philosophy and theology? So it's still a work in progress. That will probably always be a work in progress, but just at this point it still is. But what I did was I searched out some books. I got together with some rabbi colleagues of mine, and we've been reading some of those books together and discussing them. And what's been happening is that, a new working philosophy has been bubbling up for me. And I can tell you that I love my job, I bring a lot of energy to my job, but doing this work that I've been doing on retooling my philosophy has been giving me a whole new sense of energy that I've really appreciated.
Hi, my name is Bruce Cotting. I'm a massage therapist at Stanford. I do chair massage at the Women's Cancer Clinic, and I do inpatient massage at the hospital. Stanford is one of the few hospitals in the United States that has this kind of a program. I also volunteer as a spiritual care volunteer on the bone marrow transplant unit. And I do massage as a volunteer in hospice with Sutter Hospice. And I might have a tough time tonight because my mother died at 7:25 in Rochester, but she was 105. And I'm not sad. I'm not sad, but you know, there's a lot of energy running through me right now. I asked to go last so that I'd have something to say, because I listened to you guys and I've been thinking of things that sort of flow off of what you were talking about. I also might mention that I'm a hypnotherapist in practice in San Mateo. I decided a couple years ago that I could only do so much healing with body work, and decided to take a shortcut into psychology by becoming a lay hypnotherapist. But one of the things that I started doing when I was putting my stuff together was thinking about practical things you can do after you leave work. And so I thought of things like doing things for your body, doing things for your mind, and doing things for your spirit. And Rachel Naomi Raymond is a great lady because she's got great quotes. And one of the things she mentioned one time was she said, wounding and healing are not opposites. They're part of the same thing. It's our wounds that enable us to be compassionate with the wounds of others. It is our limitations that make us kind to the limitations of others. It is our loneliness that helps us to find other people, or to even know they're alone with an illness. I think I have served people perfectly with parts of myself I used to be ashamed of. The problem with stress, as everybody in this room knows, the unrecognized stress builds up in your body. Anxiety, guilt, grief. We probably have stuff in our bodies from the age of 3 because we don't have a way of working it out. Prey animals in the wild, if they're attacked and are lucky enough to get away, will shake, like a dog shaking water off themselves. And that's the way they get rid of the stress. They don't throw it in a knapsack and carry it around on their back for the next 45 years. And when they have a little too much to drink or are feeling sorry for themselves, drag it out and go through it all over again. So human beings are unique in their ability to carry their crap around for the rest of their life. So we need to find a way to get rid of it. If you think about doing something for your body, my first thought is to get into a jacuzzi until I look like a raisin and just let that hot water pull my stress and anxiety out of me. That's what I do. And so I thought I would talk about some of these little things that you can try. Some of these things you already know and some of these things you already do. Some of them might light an idea that you can use on your own. I work with a lot of cancer patients, and they come, especially to the women's cancer clinic, wearing their ears like earrings, as one patient told me one time. And it's truly amazing that you can put your hands on somebody and in 10 minutes drop their shoulders 2.5 inches. And one of the things I always talk to them about is I say, as you're in the chair, just think of the muscles under my hands getting lazy, long, and loose. And it's a little hypnotic trick, but I say that about 3 times, and their shoulder starts to soften. Not because I'm working on them, but because they're working on them. The unconscious mind is the most powerful part of your body anyway. And I had a patient come back who I hadn't seen in probably 6 months or so. She walked up to me and she said, "Lazy, long, and loose." All right. But I tell people to do that and go home and do it a couple times a day, and you guys can do it yourself. Just sit in a chair, sit in the couch, in the middle of the couch where you can't reach the armrest, and just let your arms hang down by your side. Just do it right now. Just let your arms hang down by your side. Probably outside the chair because these chairs are a little tight. Just take a deep breath. Let your stomach stick out. Nobody's looking at it. And then exhale. Lazy, long, and loose. You do that about 3 or 4 times, a couple times a day. In 3 weeks, it'll be a habit. And then you can do it when you're standing in the checkout line, or you're on 101 late for your meeting in the traffic jam. And nobody will know you're doing it, because you don't have to strike a pose. You just say it to yourself. It's a great little trick. Another thing for your body, get a full body massage. I talk to lots of people that say, "Oh, I would love to get a massage." Well, go do it then. I don't have time. Everybody in the room who's a medical professional knows the 2 parts of the nervous system, sympathetic, parasympathetic. The sympathetic nervous system is the fight or flight that goes on and off and on and off and on and off about 25 or 35 or 45 or 65 times a day. They've measured it now, and it's on and off and on and off and on and off. And your immune system in the beginning says, "Okay, I'm ready for that." But after a while it goes, "Hey, you've cried wolf too many times. I'm turning off." When your immune system turns off, guess what? You don't have a response to disease, and you get sick. If you can calm yourself down, get the parasympathetic nervous system working, your immune system works better. Now, what better motivation than that? So, a full body massage helps calm down the nervous system, get into the parasympathetic nervous system, and let you to truly relax. Reflexology. A great foot massage is to go to a reflexologist and spend an hour lying on one of those chairs. You stretch out and have them work on your feet. And they've got places now called Happy Feet, where you can go in for $25 and they'll, drill holes in your feet with their thumbs, and it's a great way to relax. Reiki, healing touch, other energy work. There's probably 100 salons and studios in the area around here. Try them all. Try them all. There's one I didn't write down. Actually, it's called Feldenkrais. And Feldenkrais is very easy work, usually done through senior centers and places like that. And I have a friend of mine that goes, and she says, "I love this place because I can lay on the floor and just lay there, and nobody will care what I do for the next hour." Listen to music, but more important, sing. Life is about moving, and singing is vibration. If you say a mantra to yourself, every cell in your body is vibrating with that mantra. You could say lazy, long, and loose if you wanted to. You could get up in the morning and say your full name, "I love you," in front of the mirror. "I unconditionally love you, accept you, and cherish you, just the way you are." I've done that work with hypnotherapy clients. They can't get the words out. We don't love ourselves for lots of reasons, but you can push through that. You can sleep more. You can cry. Now, I have a dry eye condition, and tears will come out of this eye automatically. So I can get by with crying and nobody knows that it's just... that's sort of the soothing stuff. I don't know if crying is soothing, but they've actually found that tears of joy have different chemical makeup than the tears of of sorrow, which is interesting about how your body reacts to things like this. Exercise. Everybody tells you to exercise more. Walking, running, swimming, yoga. Swimming. They have these water aerobics classes. I think those are great because you don't have to work real hard. The water sort of supports you, and that's cool enough that you build up a little heat yourself doing it. But I'm like a consultant, which I was for many years before I became a massage therapist. So I don't do that myself, but I recommend it to other people. Yoga, lots of people do yoga. Dancing, just stretching. You can do stretching, floor stretching in your living room or at home without joining a club and spending a lot of money and things like that. And lots of people don't do enough stretching. And they get up in the morning, oh, I must have slept wrong. Well, how many, have you stretched those rhomboids in the last year and a half or two? Do something for your mind. Turn your television off. Pull the plug on it. Sell it. There's nothing on television that's going to help you. One iota. Certainly not the news. I was giving a patient a massage today in the hospital, and she's watching on her iPad The Mentalist. How can you calm down when you're watching? Calmness, I think, is what we're talking about, a lot of us are talking about, and you can't do that with the television on. At least not the nightly news. Sleep, we talked about before, get enough. Journal. This is something you can do for your mind, and we were talking about the narrative. Write your narrative as a journal, and then just keep adding to it. And you don't have to buy anything expensive. You can do that in the word processing program you're using today. Put in the date, then write what you want. Or you can do it in hand. Lots of people like to write in hand for that sort of stuff. Relaxation. You can go to a hypnotherapist. You can use a guided imagery tape. You can find a point of relaxation and then scale it on a scale of 0 to 10. And so if you get to this point of relaxation and you give it the number 9, every time you want to go back to that, you can just think to yourself, 9. 9. Take me to a 9. And I've heard of people successfully getting through surgery without a lot of complications from anesthesia and actually taking less anesthesia, chemical anesthesia, by using that technique. It takes practice. It's not something you can just take off the shelf, but certainly a good thing to try to do. Again, for your mind, meditation. We talked a little bit about ritual. Have a ritual. Make a ritual. But don't beat yourself up for it. If your ritual is to get up 10 minutes early and sit quiet in meditation, don't beat yourself up if you forgot to do it on Saturday. You slept in and you said, I'm not going to do it. Don't beat yourself up. But find a place in your home. Do it preferably at the same time of the day. And you don't have to do anything elaborate. You can light some candles, you can put on some music, but you don't have to do anything really elaborate. If you're interested in starting a meditative practice, I would suggest the work of Adyashanti, and I'll spell that for you. Adyashanti. Adyashanti. He's local. He's a trained Zen Buddhist, but he's also was raised as a Christian. And he doesn't get overboard on the spiritual side. He's very practical about how to meditate, how to contemplate. One of his great books is called True Meditation. And of course, there's different kinds of meditation: guided imagery or visualization, mindfulness meditation, transcendental meditation. If you're interested, all you have to do is Google meditation Northern California. You'll get 6 zillion places to get started. And I think the third thing that I was going to raise is do something for your spirit. I work with Lori on one of the units. I'm an interfaith spiritual care volunteer. And I think it's, even if you're secular, if you believe you're secular, you can still have a spiritual tradition. You can call it the universe. You can call, there is a sense of something around us that we have no idea what the plan is. You talked about God makes me do this, hands me this to, we have no idea why this stuff happens. Why did my mother live to be 105? She was an LVN in Rochester, New York, and she worked in a nursing home. In those days, you had to retire at 65. She retired at 65. The next Monday, she went back to work as a volunteer and worked till she was 84. Why did she live to be 105? Because the last 2 years, she's been in a convalescent home. And as a patient, she's teaching some nurse or LVN or RN, or PA, how to be with a patient. But she would sit there and ask, why am I still alive? We don't know. But I think we need to have a sense that there's something greater than what we're doing between two human beings. There's a course called A Course in Miracles, and there's a great line from that book called, I can find peace in this. To say to yourself, I can find peace in this. And there's lots of situations like we've talked about that are very, very stressful for us. But we can find peace in this. This is my favorite recommendation. Buy a heating pad. Put it on your shoulders. Theratherm, and I don't get a commission from Theratherm, but Theratherm sells 3 different size heating pads, and for massage therapy I bought one that covers your entire back. So you can put it on top of somebody and they just lay there and they're gone. But you can get them and you can put it on your shoulders, and it's got a thermostat and a timer. So it's never going to get any hotter than what you set the thermostat for, and if you fall asleep it's not going to stay on forever. And they're great. And again, get in the middle of your couch, let your arms hang down, put that on, glass of red wine, no television, little music. And we mentioned Code Lavender early. Code Lavender is being practiced in a couple medical facilities around the country. Cleveland Clinic is doing it as part of their healing services. And they said, it's like Code Blue, but it's for the human spirit. And when they started it, they thought it was going to be for patients and families. And they found out it was the healthcare practitioners that were using it more often than anybody else. McKesson Better Health, Code Lavender is the integrative healing equivalent of a Code Blue. I don't think we're doing it at Stanford yet. So now everybody, any of you who work at Stanford can now start to boil this up from the bottom and find out if we can get the folks at the top to think about it.
I'm taking notes.
And I actually think that's just about all I have. We had a hospice massage practitioner who has trained lots of people in massage one time, and she said, if you're uncomfortable in the position you're working with the patient, because lots of times in hospice the patient is not in a bed that you can raise and lower, and you end up working on your knees to do the work. And she says, if you're uncomfortable, the patient is going to feel that. And I truly believe that if we're uncomfortable and simply walking in to talk to a patient, they will feel that. The energy level that Lori was talking about, we have an energy electromagnetic field that's probably as wide as this table is long. And we're all connected right now. And if somebody were to walk in the room, you would feel it. You would know it even if you weren't looking, because that energy is there. So people can feel your energy. And if you're not energized, if you're not taking care of yourself, like we've said before, you're not going to be you're doing a disservice to the patients in a way. So that's all I have, and I get the privilege of handing this mic back to Lori because I'm sure somebody's going to ask her the first question. So we're going to open it up for questions and answers.
Well, I have a comment on just kind of like what the panel was talking about and thinking about it. It's just a matter of you hear all these ideas, and so now you just have to decide, okay, what am I going to do? Pick something and just go do it. Whether it's washing your hands and being aware that you're doing it and having that experience, or listening to music or having a massage. You just have to pick something and do it. It's as simple as that. And you can hear the impact of what we're saying, but really, truly, in knowing yourself, you have to decide what is it that you're going to do, what's going to work best for you, and just pick it and do it.
I actually prepared something called an appreciative inquiry, which I was going to hand out to you and split you into pairs and have you interview each other, but we didn't think we'd have enough time for that. But I'm going to ask you this question anyway. So if you would be willing to share with us, because again, and Ellen, who's a nurse in the front row and also a healing touch therapist, we were chatting earlier, that the wisdom is in the room. Everybody in this room has been through adversity. Everybody in this room has been to the point where they've wondered what they were doing in life or in their job or whatever, and been at a low point. I know, we all have, we're all human. So think back on a time when you were depleted or you were at a low point or a particularly rough patch in your life or in work or whatever. And just take a moment out and think about one or two strategies, self-strategies, restorative strategies that you did for yourself, whether that was reaching out or whatever. So think about that for just a minute, if we could have a moment of silence. And then let's share that with each other. We're just not that big of a group that we can't do it. Who would be willing to share? Who would be willing to be vulnerable? That was a theme tonight. And authentic was another theme tonight, to share a self-care strategy that you used. Joan.
So some of you know, I also lost my husband suddenly about a year, about 14 months ago, which was an incredibly devastating time for me. And I've been a nurse for 33 years and developed a lot of techniques, and I really struggled with my and I'm still journaling. I find that very helpful. It often makes me cry to journal, but I feel so much better afterwards. And that's a new skill for me. I never did that when I was a nurse at the bedside. The other thing I did, and something that I've done all my life, is to reach out to someone. That works very well for me. There's not a lot of people. I have a lot of friends in my life, but there's usually only one or two people that serve that role for me. But those people really have helped me get through. So those are the two things that I have found the most helpful this last year for me. So.
It's coming your way. Gosh, I am not a professional caregiver, but I think I am a professional caregiver. I don't get paid for this. My husband has had cancer for 5 years, and my life is about caregiving in some way. And I think one of the things that Joan said is reaching out to friends has been a really big piece of sanity. Forgiving myself has been another really big piece. Sometimes just taking time for myself. It's probably the biggest thing. And also being with other people who have the same experience and sharing myself with them, really, really powerful.
Lori, anything you want to say in response to anything so far, or anybody else in the panel? Just talk up.
I think you made an important point, because I think as a caregiver, I often tell that caregivers are the veterans, that you need to take some time for yourself. I don't care if it's 10 minutes and you go to McDonald's and sit and have a cup of coffee, but you need to do something. You just can't be there. You know, well, they don't want me to leave. Well, they might not want you to leave. Here's when I become very practical and come evolved as a therapist, is that, but you have to take care of yourself. And it's really good that you do that. And it's okay that you do that. And you do need to take that time out, whether it's having that cup of coffee or making a phone call or just, you know, going for a run. But it's really, really helpful and healthy that you're able to do that. And important as your role as a caregiver is to have that moment that you can say, okay, you're going to be okay, and that's the message to your husband, that he's going to be okay, that you'll be back. You're just going to be gone, and you have your cell phone and all that, and reassurance. But that's something you need to do for yourself. And I tell caregivers that I work with that they really have to do that. And then they'll come back and they'll say, yeah, I went to McDonald's, I had coffee. I was gone 15 minutes, I came back and he was still sleeping. And I go, yeah, it really works. You know, it really, really does work. And so that's great that you can do that.
One other thing I think that is really important, at least for me, and I don't know how it applies to other people, is to kind of reframe what you hear in the world. Because as a spouse or as a family member, you hear a lot of people giving you advice or just diminishing what you're going through. And it's really important for me to be able to separate from what they're saying. Whether I say to myself, they're uncomfortable and they have to say what they're saying, or whatever I have to do to make it okay for them to say it, but not for me to take it in.
Yeah, if I could say something about what you were just saying about reframing people who might be diminishing what you're going through or giving you advice. I think we are enormously inventive in finding ways to tell each other to be quiet when we're uncomfortable with what somebody is saying. And I think that those kinds of statements where somebody is diminishing you it's about them. It is about them, and they're not being able to tolerate hearing what you're going through. I mean, in some ways, it's almost the opposite. It's actually the enormity of what you're going through, or the fact that what you're going through is quite profound, which is exactly what leads them to try to diminish it. Yeah.
If I could just add one word to that, it's the word fear. I think, fear response will arise in them because they're afraid of what's happening.
Yeah, we're afraid of our own mortality.
You know, it's very interesting. My ex-husband is an LCSW in practice, and he actually spoke one night, and he was talking about there's some research out there that you were comparing us to our animal companions, right? And that they've done some studies in that some animals will stay with a dying animal, but other types of animals will avoid a dying or wounded or depressed animal. And there is some kind of, what's the word, self-care in that, because someone who appears ill, if you're an animal, could have a disease you could get. And so there's some thinking now that there is something within us that makes us want to avoid people that are feeling stressed or down or depressed, because there's kind of this old inbred notion that you could get something from someone who's not doing well. It's just an interesting thought, because you do see when you go through periods of stress or grief that there are people who just cannot be with you, even people who could be with you before. You learn so much about people's capacities themselves.
Well, and
Yeah,
I think it's neither right nor wrong. It just happens to be how it is and who they are, and just being like what you're saying also, again, just being able to accept it. that that's just how it is.
And I think it's okay for us to recognize that it's
Yeah.
okay to pick and choose, and that if there are those people in
Absolutely.
our lives that aren't good for us when we're feeling that way, that we don't have to interact with them, that we can say, can I call you tomorrow? Or whatever. I mean, obviously in a loving way, but there are people around us who are not helpful to us sometimes when we're stressed or grieving, whom we love and who love us, but just are not helpful in that moment. So
Yeah, there was a book written, I can't remember the author's name, but the title is I Don't Know What to Say.
sure.
And explains a lot of this about how people react and they don't know what to say. And they come
Right.
up with off-the-wall things like,
Unbelievable things,
Oh,
as
yeah.
we all know.
Yeah.
Unbelievable
Yeah.
things.
there's also a book, we're all bookies here. Her last name is Marjani. I think it's Moorjani, and the title is Dying to Be Me. And it's a woman who has a near-death experience. She's a cancer patient, lymphoma, I think. And it's interesting to me because she explains the near-death experience to quite a degree. And she talks about threads. And as you mentioned this, that everyone we've ever met, everyone we've ever had a connection with, the school bus driver who drove us to school, is a thread that connects with us in this huge carpet that goes from everywhere to everywhere. You can't see the edges of it. And if you're secular, that's a great one to use instead of all the others. And that's interesting because every patient we see, every colleague we work with is a thread in this. And that could be the start of your narrative.
I just want to go back to some of the opening points that Jim made about that this is what I can do right now. This is, not judging yourself, and this is where I am at this moment, and push through for this, but sometimes I can't push through for others. I have to stop and take back. I thought so many of the things you said, Jim, were, again, weaving the themes or the threads through tonight's conversations. Do you have any?
Yes, actually, in answering the question that you offered to all of us, I was remembering the time right after my wife died. And I don't know where this came from, but I remember being conscious of an intuition that told me that I had to take better care of myself than I had ever before. That I just knew that I was in a very demolished, comes to mind, condition. And one, I couldn't expect myself to live up to the same standards that I had before, and I was running my own web business. So I had to be able or willing to allow myself not to live up to the standards I was before. And the other thing that I remember about that time is I decided that I was going to look at every choice that I had, every invitation, every offer by someone, and I would promise myself that I would say yes or no to be true to myself in that moment. So I would get an invitation at one point, and it felt like that would contribute to my well-being, and I would say yes. And I would get an invitation at some other point, and it didn't feel right, and I would say no. So I allowed myself to be inconsistent in terms of the way the world would look at me, but the consistency that I maintained was always in the moment to choose the path of well-being.
So again, loving oneself and then putting the relationship with self at the forefront.
Yes.
Very important. How about, anybody else have a thought?
Questions?
Or any questions or any, from your own experience, from your own wisdom, strategies that work?
I have a few small
Yeah,
strategies.
Cynthia?
So,
Whoops, excuse me.
there's a piece of music by Bach, the Goldberg Variations. If you've never heard it, you should listen to it. It takes about an hour or close to maybe 45 minutes to listen to the whole thing. There are a few variations. It's one theme, and then Glenn Gould is one of the more famous performers for this. And it's a journey, and I found that when I'm having trouble, like there's an event, I've had some pretty big events, I've had small events, but when there's a big event that I'm grieving and I'm feeling stressed, I'll put this music on. I'll sometimes play it every day. You know, it's kind of like that's the time to play the music. And I found that because it has had a calming effect on me in the past, it, as you say, it's like the number 9 or whatever, it'll start to take me to the place of calm and resolution, because that's my go-to piece. So that's one little thing. And then the other thing, when you're washing the hands, I wash my hands every evening as soon as I walk in the door. I have some nice soap that I wash my hands with in a bathroom, and then I feel like I'm ready to be home. I've washed away the outside. I've entered my home and my place of rest, and to be with my cats or my family or whoever's there. Yeah. So
those would be described as healthy rituals that you and sacred and to you. Anybody else? Here? Yes.
Thank you. So this is a little bit of a repeat, but I loved many things that many people said, but I'll come back to what you said, Bruce, about the number 9, and you just referenced it again. I found that it's really helpful to come back to how I feel in my body. Whatever's going on around, it's a place to get grounded and centered. And that sense of balance that we all can feel at times, to notice what it feels like when it feels that way. I love what you said, give it a number 9, but whatever you give it, to find a reference point that you can return to, and just noticing it will build your awareness of what that is. At least I found that to be so. I found that to be very helpful.
I think that's really what Jim was saying too, when he was, making decisions in the moment for everything that was going on in his, all the questions that were asked in his life, all the invitations.
And Jim mentioned being kind to ourselves. There's a program at Stanford on compassion, and I can't remember the title of it, but it's a full-fledged program. I think it's 8-week or 10-week program, and that's one of the things in there is self-compassion. It's a very interesting program to take.
The program on forgiveness, perhaps?
No, it's not forgiveness. It's the other.
Yeah.
Yeah.
It's an 8-week program that's offered through the C-Care group, and anyone can take it.
Yeah.
And then there's the forgiveness workshop that's coming up here, right? Lufkin's?
So I just had a follow-up comment. We've been, of course, talking about caregivers here, but a few years ago, my son was in a traumatic ski accident, and the next day my mother had a stroke, and the next week my husband didn't get the dream job of his life, and so it was really a very, very difficult time. And I learned, even though I had understood this before, is that I needed to be a care receiver. It was my season to not be giving because I had enough to do, and there were people from my church who, let me bring you dinner, let me take your other child to school, let me do your grocery shopping, and it was, I just learned to say, yes, I need this. So I needed to be a care receiver as opposed to a caregiver at that time.
Which means that, it's that shift that you have to deal with. And the shift and the recognition that you can't do those things, whether it's dropping your kid off at school or or running to Whole Foods, you can't do it, and it's hard, and it's hard to kind of let go of that, But I want to go. I want to pick my kid up at school because that's what I always do, and all of those kinds of things. So to be able to shift that to people that are asking is a huge step.
the harder step than giving.
Because it's a loss. It's a loss of a loss in so many different ways, especially in the loss of something that now you're just giving up.
I just have to say, I think one of the things that plagues us as professional caregivers too is that we do see ourselves, probably appropriately so, as being very strong, emotional people who are always able to care and give. And so it's very hard for us to see the weakness or the limitations in ourselves, because we always want to be the one who's there for somebody else, to fix it, the fixer, absolutely. And I think when you are forced, as I was in my life, to not be the together perfect caregiver person that I was for everybody else, and to focus on myself, I think the beauty, and you guys have talked about that, of when you are forced to confront your vulnerability, you actually become stronger, because it changes the way you view other people's vulnerability and the way you view other people, you know? And so there's so many kind of gifts that come out of that, but we often don't give ourselves permission to not be the perfect caregiver all the time to everyone. You know, we were talking, you know, I'm actually have a woman living with me right now who has breast cancer, and I'm her caregiver. It's a long story, but sometimes I have days, and she's been pretty easy actually to provide care for, but some days I don't want to really be particularly compassionate to her, which is probably compassion burnout or whatever. And, you know, at first I think when we have these feelings, we judge ourselves and we think we're bad people, or why am I not the loving person I always am? So again, it's kind of accepting our limitations and our responses that are natural to the stressors and the griefs in our life. So that's the self-love piece too,
Again, that
right?
it's okay, and you're not putting a value on it, that it's neither good nor bad. It's just how it is, and
You know,
it's
I think,
okay.
at least in nursing, we're coming a long way in that regard, because I think it's becoming more okay, I hope, when we're out there working with our teams, to say, you know, can you cover, I need to take a walk, or to sit in the break room for a few minutes. You know, that used to not be okay. So hopefully we're moving to a healthier place.
I've noticed a change just in the 7 years I've been working as a chaplain. And, you know, initially, who's going to trust me? I've been there 5 minutes. They want to make sure I can care for patients first. But even after that, I feel like in more recent years, there's been more permission. And sometimes I'll walk onto a unit, and one of the nurses who's been there for a while will say, you know, hey, Lori, would you go, you know, talk to so-and-so? They had a patient die last night. And you know, I also often find that when I do go up to start to, you know, just offer myself to talk to one of the nurses, you know, there's this initial, no, I'm fine. And then they keep talking, you know, like barely a break, and keep talking. And then we're in the conversation.
Because then we don't have to admit it, but you can figure it out. Just listen a few minutes, right?
That's right. Yeah. But I do feel that there's kind of more of a cultural permission in the past few years. Yeah.
So again, the themes of being vulnerable, leading to authenticity, and authenticity giving you a certain strength, keep surfacing here tonight. We didn't get everyone. If there's anyone who has one last thing, yes.
I just want to say, I'm not a caregiver, but I've been working in the cancer world for 40 years. And I ran across a quote from a physician up in San Francisco. And the quote was from Plato that said, "Be kind, for every person you meet has a great battle." Mm-hmm. And it doesn't mean I have to take it on. It just means I have to acknowledge their battle. And it allows me to acknowledge it, let it go. If I think that I can help reduce the tension of that battle, I may do that, but it's my choice. But what I need to do is understand that that's their battle, and that every person I meet has one, whether it's paying the rent, dealing with their treatment issues, somebody died in the family. I just acknowledge it, and I don't have to take it on. But it's given me compassion and a kindness that I think was there, but I never really recognized it that way. And I say this because a funny thing happened to me. I go across the Dumbarton Bridge every single day because I work in Fremont. I come home late at night because I go late. I come home around 9, 10 o'clock at night. And there's always been an Asian fellow at that place collecting my $5 because I don't have Fast Track. He's not there anymore because Fast Track has supplanted him, right? He's gone. But I'm aware that he's not there. So one day I'm driving across the Oakland Bay Bridge, and there he was. He'd been moved. So I said, hey, there you are. And he said, what? And I said, you used to be at the Dumbarton Bridge. This is a forgotten man. And he said, yes, I was. Thank you. And I was dumbfounded, but there he was. So I come back literally 3 months later, and I get him again, and he says, welcome back. And I thought, I don't believe this. But it is that sense that we all matter. We can't always change it, but we matter. And I think that's what all of you do. I'm not in healthcare, but you matter. We all matter. But I'm delighted you're here, and I hope you appreciate what you do for other people, because it's really important.
In closure, you're probably glad to hear that word. But in closure, and again, I think these handouts went out.
A lot of people have them, and they're on the table. They're on the table there? Oh,
So we talked a little bit about decreasing gratuitous negativity, turning off the television, being aware that there are some people you can't be around at certain points. Making those choices about that. And in this slide, some of all of these things are kind of summed up here, I think. Disputing negative thoughts, reframing, stop ruminating, stop it with healthy distractions, changing your state, stepping back, becoming more mindful, present, non-judgmental with yourself and with others. We talked about the media. We talked about gossip and sarcasm. Being aware of hot buttons and circumstances that get blown out of proportion, like the commute you were talking about before. You get crazy because the person in front of you is not driving fast enough or whatever. But kind of be careful not to get caught up in that, because we have enough stuff already that we can't avoid, enough adversity we can't. Finding healthy methods of dealing with difficult people, and maybe just saying no. I can't do it right now, and not judging yourself for saying that. And then on the positive side, being kind, kindness and positivity feed. They're the feed of the soul to flourish, and what we give out, we get back in life, which is the story that you told. Psychological reciprocity. Sincerity. You can't just be the happy, smiley face. It has to be sincere. We as humans are wired to recognize insincerity very quickly. So, and it's depleting, actually. Finding positive meaning, reframing. You talked about reframing things, but finding a positive meaning and a purpose and a mission. If I have a mission statement for my work, and I read it every single day to make sure that I'm sort of on path and that I feel like I'm doing something. And I think that's a very valuable, worthwhile exercise for everyone. Savoring goodness, taking a moment out to taste the blueberries, what they really taste like. I have a girlfriend who's very religious, and she says a prayer before every meal. And one day I went, bingo, why don't I stop and take a moment and be grateful for what's in front of me? Which leads into the next one, which is counting blessings, grateful appreciation. I have a little thing sometimes when I can't sleep. I'll start with the letter A and go all the way through the alphabet and try to be grateful for one thing, like A for apples. I love apples. I'm grateful for that. And then moving on. Living with passion or flow, you talked about that, getting into the zone thing, I think, Karen. That's the flow. And finding hobbies, and your kids, your grandchildren, and it just makes you happy, those kinds of things. And then dreaming more, just dreaming and visualizing positive. Exploring positive psychology, there's 10, 12 years worth of really cool research on that. And there's a series coming up, right, that's going to be given here. So that would be a neat thing to do. You talked about learning about your own strengths and applying them. I don't know if there's a list of books in the back. One of them is Strength Finders. You might take a look at that. Developing high-quality connections, and that's not just a phrase, that's an actual construct now that there's a lot of research around. It's very important. Maybe there's somebody in the room here today that you can develop a high-quality connection. Nature, spirituality, opening your mind for mindful meditation, and loving kindness meditation. All of these things are now science-based. We used to, just talk about them and share them because we know we have that personal wisdom, but they also now are very science-based, that this is what helps us build resiliency and capacity to face life's inevitable adversity. So I think we can all say good night and thank you to each other.
Thank you all.
Thank you guys. Thank you for being here.